Hello, my name is Heather Beavers. I'm a nurse practitioner student at Texas State University. Earlier, I completed the health history of our patient, Mr. DW, and I'll continue on with the physical examination. So I'm going to go ahead and enter the room. I'm going to wash my hands, and I'm going to look at his general appearance. I'm going to see if he's relaxed, if it seems he's nervous, if he's grimacing or guarding any area, and it seems like he's relaxed, no pain anywhere. So first I'm going to start off by looking at the skin of his arms. I'm going to be looking for the texture, the warmth, any lesions, if it's smooth. And it looks like he has warm, dry skin. The color is normal for his ethnicity. We're going to do it on both sides. No lesions, no moles. And while I'm up here, I'm going to palpate your axillary nodes. I don't feel any lumps or nodules. Do you feel any tenderness? No, I'm going to do it on the other side. Okay, now I'm going to go to his fingers. I'm going to look at his nail beds. It's pink, no cyanosis, no clubbing. Capillary refill is less than 3 seconds. I'm going to feel his pulse, his radial pulse on both sides. It's 2+, brachial. Okay, 2. Okay, 2. So now we're going to do some exercises. We're going to start with your fingers. I want you to make a fist and then extend your fingers. I want to put your fingers close together. We're going to abduct them and then abduct. We're going to spread them out. All right, very good. Now I want you to take your thumb and meet with each finger. I want you to keep going. We're also looking for rapid alternating movements. Okay, very good. Now flex your wrist, but have your arm just like that, okay? So I'm going to pull your wrist down and you meet me, or you try to resist. Okay, very good. Now I'm going to stick my fingers in your grip here, and you try to prevent me from pulling out. Very good. So now I want you to put your wrist just like this, and then resist my movement. Go ahead and try to push down, push down. All right, we're going to have you flex your elbow. I want you to resist me. Resist the other way. Okay, do it for the other side. Okay, so I want you to flex. I want you to extend. I want you to keep your palms up and then down. Okay, now I want you to put your arms to your side. And I want you to elevate right here and then try to push my hand down. Okay, try to push my hand up. We're going to do the same thing for this side. Down and then up. Okay, now I want you to put your arms forward, then all the way back. We're just looking at the shoulder range of motion. I want you to put it to your side, all the way up above your head. I want you to put your hands behind your head. We're looking at the internal and external rotation. Now behind your back. All right, very good. Now I want you to take your finger and touch my finger and then touch your nose. All right, very good. Now what we're going to do is just look at his reflexes here. I'm going to start with the brachial radial. I want you to just relax your hand there. Okay, we will see normal flexion or reflex. Okay, very good. His brachial. Say that was a 2+. Okay, that's a 2+. Sometimes you won't see the brachial as much, but you'll definitely feel that contraction. Okay, very good. We'll look at the tricep. Okay, very good. 2+. All right, very good. 2+. I want you to shrug your shoulders up against my hand. Very good. Now we're going to move on to the face. I'm looking at the general appearance of his skin, his facial structures, making sure that it's symmetric with his eyes, nose, and mouth. I do see that his hair, he does have facial hair along his jawline and upper lip. Eyelashes are long and uniformly distributed. Eyebrows are thick and black. Next, I'm going to take a look at his scalp. I'm going to palpate for any deformities, any lesions, or any wounds, even any moles, or even lice. His hair is brown, it's thick, and uniformly distributed. Any tenderness?
No.
All right. So now I'm going to take a look at your eyes. I'm going to look at the, I'm just going to palpate your lower eyelids with the conjunctiva. Okay, it's pink. I'm going to look at the upper eyelids. Okay, can you look to the right for me and then left? Okay, the sclera is usually white and the cornea is transparent, and you might see some small blood vessels, which is normal. So now what I want you to do is just follow my pen. We're going to go in different directions here. Okay, now I'm going to shine a light right at his nose. I'm going to look for the corneal reflex, and in each cornea I want to see that light reflex, which is equal and symmetric in both eyes. I'm going to look for the pupil response. I'm going to look for a direct response, which the pupil will constrict in this eye, and a consensual response where it will constrict in the other eye. Which is positive for both. It's equal, round, and reactive to light. Now I'm going to have you look far away in the distance at the back of the room. Then I want you to look at this pen. So I see his eyes converge. I see his pupils accommodate to the pen. I'm going to have you follow it all the way up, and his eyes converge. Now, at this point, I would use an ophthalmoscope, but I do not have one. But we would go ahead and shine it right on his pupils. The light will shine right on the retina, will show a red reflex, and you'll zoom in and you'll look for the optic disc, which is well defined. It's yellow creamy color. You'll be looking at the blood vessels in the eye as well, the arterioles and the venules. Usually the arterioles are a little lighter color and the venules are a little bit darker. But you don't want to see any lesions or any deformities in the eyes, and we're just going to say that it's normal for both. Now we're just going to go ahead and palpate his frontal sinus. Any tenderness?
No.
His maxillary sinus, any tenderness?
No.
Okay, we're going to percuss. You tell me if you feel any tenderness. Any tenderness?
No. No.
Okay, now I'm going to palpate his nose, his nasal bridge. And it's symmetric, it doesn't deviate to one side. If you could just close one nostril and blow out. I'm looking for the patency of his nostrils. Do it to the other side. Both sides seem pain. I would take a speculum to look inside his nasal mucosa. But I don't have that just quite yet. But I'd look for any foreign obstructions, any drainage, masses, lesions, or any redness. So from here, I'm going to move to his mouth. I'm looking at his lips. It's pink. It's not cracked. It looks pretty healthy. No lesions. We're going to have him frown for me, and then smile, and then puff out his cheeks. All right, very good. Now I'm going to take a look inside his mouth. Go ahead and open your mouth. I'm looking at the hard palate, which is usually white or lighter color, and the soft palate is pink. I'm looking at the back of his mouth. His uvula is midline. His tonsils are present. It's about a 1. Can you say ah for me? His uvula does move when he does that. Tongue is midline. Oral mucosa is a little dry. I'm looking at his dentition. No missing teeth. Looking at his gums, it is pink. There's no bleeding or lesions. Now, if you could stick out your tongue for me. Okay, it is midline. I don't see any lesions. Now, if I did have gloves, I'd go ahead and palpate his oral mucosa, looking for any lesions, masses. I would palpate his salivary glands as well, but I don't have that. All right, let me grab some things here. So, what I want you to do is take your tongue and press it against your cheek and meet resistance with my hand. We're going to do it to the other side. All right, now I'm going to feel his temporal artery. All right, and I'm just going to take a listen for any bruise. Which I don't hear. All right, now I just want to take this instrument and you close your eyes, you tell me if you feel it, okay? Next, we're going to go to his temporal mandibular joint, his TMJ. I'm going to have you open your jaw, close it. I do feel clicking, which is normal. Next, we're going to move to the ears. I'm looking at the external structure, any skin lesions or deformities, any masses, any tenderness that you feel when I
No.
All right. So I would use an otoscope at this point. We would look in the inner canal, and we might see some earwax or cerumen build up. We don't want to see any floor obstructions, but we'd pull the ear up and back, and we'd progress the speculum into where we could see that tympanic membrane. We would see if it's concave. We want to see that light reflex. It's usually, the membrane's usually pearly gray. And we want to see that the pars tensa and the pars flaccida, as well as the short process of malleus, as well as the long process as well. Also, you kind of want to look around the edges of the tympanic membrane for any perforations, which we do not want. So next, what I'm going to do is we're going to check his hearing. I'm going to close his tragus, and I'm going to whisper something. You tell me what you hear.
B2.
Okay, I did say that.
F11.
All right, very good. We're going to do a Weber test. I have this instrument. I'm going to bang it against my hand. It's going to make a ringing sound. Place it on top of your head. You tell me if you hear it more on one side over the other, if you hear it same, or not at all.
Same.
All right, very good. That is a normal finding. All right, next we're going to move on to the neck. I'm looking at the general structure of his neck. I'm looking for any palpitations, pulsations, any lumps or nodules that should not be there. I want to go ahead and fill his trachea. We want it to be midline. I'm going to have you swallow for me. And I kind of pinpoint where that thyroid gland is, so I'm going to go behind and palpate it. I'm going to displace it to one side, and if you could swallow for me. All right. I don't feel any hardness or nodules. I'm going to do it to the other side. You do the same, swallow. And I feel that thyroid gland cartilage move up underneath my fingers, which is a normal finding. So next, we're going to go ahead and feel his carotid pulse. It's a 2+. I'm going to take a listen for any bruits. I did not hear any. We're going to go ahead and palpate his lymph nodes. We're going to start with the preauricular. And then I'm going to go ahead and fill his mastoid process while I'm here, and then go into the postauricular lymph node, the occipital. We're going to move down to the posterior cervical. I'm going to do the deep cervical. Any tenderness?
No.
Superficial cervical. We're going to do the tonsillar, submandibular, submental, and the supraclavicular. All right, very good. No tenderness?
Nope.
All right. So while he's facing forward, I'm going to take a look at his front chest, see how he's breathing, see if it's normal, if there's any retractions or abnormal movements, and it looks like it's equal, so I'm going to take a listen. Airways sound clear. There's no wheezing. I do hear vesicular breath sounds. All right, very good. So at this point too, I would palpate the chest area for any lumps, nodules, or tenderness, and you let me know if there's any tenderness. All right? And I'd also look at the nipples as well for any discharge. Any tenderness?
Nope.
All right, very good. Now we're going to have you move to the back, so we can take a look at your back. Now we're going to be looking at his lung expansion. Also, we're going to be looking at the skin, see if there's any lesions, the texture, the color, the temperature. It's smooth, warm, no lesions. I'm looking at the way he's breathing and how his chest is expanding, or his rib cage is expanding. I'm going to go ahead and place my hands on either side and have you take a deep breath. All right, very good. Now, usually you do want the AP diameter or the anti-posterior diameter to be less than the transverse, which on this patient it is. So we're going to go ahead and take a listen. Listen to the lateral sides here. Okay. He has a regular rate of respirations, vesicular breath sounds, not diminished, no wheezing that I heard. Next, we're going to go ahead and percuss your lung fields. Usually, when you percuss, you'll hear a resonant sound. So it tends to kind of dull down right there. So next, I want to be looking at the CVA tenderness, the coastal vertebral angle tenderness, and usually that's an indication for any type of kidney injury or any problems with that. So I'm going to place my hands right here, and you tell me if you feel any tenderness.
No. No.
Okay, so now I'm going to have you lay flat on your back. And we're going to take a look at his heart. We're going to look at the angle or the point of maximal impulse or the apical impulse. I don't see any pulsations or heaves. I'm going to go ahead and palpate. All right. And while I'm here, I'm going to go ahead and check his skin turgor as well, which is a good indication for hydration, which is very good. So we're going to go ahead and listen to 5 points of where I can hear his heart sound. So the first one is going to be the aortic area, and then the pulmonic, and then the herbs, the tricuspid, and the mitral area. I'm going to go ahead and put my stethoscope over the apical impulse, and I'm going to listen for the rate and rhythm. He has a regular rate. I hear the S1, S2, no murmurs. And we'll go ahead and say that his rate is 66. Now I'm going to listen to the same areas with the bell of my stethoscope. So again, it's the aortic, the pulmonic, the herbs, tricuspid, and then the mitral. All right, we're going to go ahead and move on to the abdomen. We're going to look at the color, the contour, the symmetry, paying attention to the umbilical region for any pulsations. Noticing his abdomen, I do see some sparse hair below his umbilicus region, which is normal for his gender and age. I don't see any pulsations, so what I'm going to do now is go ahead and listen to his bowel sounds. We're going to listen into 4 quadrants here. His bowel sounds are hyperactive. And from here, we're going to go ahead and listen to his aorta, artery, the renal bilaterally. We're looking for any bruits here. And this is with the pelvis stethoscope. And then we're going to move to the iliac. And I do not hear any bruise. Okay, next we're going to move to percussion. Usually over the abdomen, you'll hear a timpani sound. Okay, I do hear that. Now I'm going to do some light palpation. You let me know if there's any tenderness. Any tenderness?
No.
Okay, we're going to move into a deep palpation. Any palpation or tenderness?
No.
Okay, we're going to palpate his liver, and I feel the edge right there. So I'm going to have you take a deep breath for me. Feel a little bit better that way. All right. Breathe normal. All right. I don't feel any masses or lumps or nodules. I'm going to go ahead and palpate his spleen here. I'm going to place my hand underneath his rib cage here. With my other hand, I'm going to see if I can feel that spleen there. All right. Very good. Get you closed. We're going to take a look at your lower extremities. We're just looking at the skin texture, color, the symmetry. I'm looking for any swelling, lesions, or deformities. He does have hair on his lower legs. I don't see any pretibial edema, no patellar edema, or malleolus edema. All right, so I'm going to fill your femoral artery. Okay, it's about 2+ on that side. 2+ on that side. So I'm going to also fill your inguinal nodes here. Okay, while I'm in this region, I'm going to listen with my stethoscope for any bruise on your femoral artery. Okay, I do not hear any. Okay, we're going to move down his leg here and look at his feet and his toes. I'm looking in between his toes for any wounds, which is very important for diabetic patients. Looking at his nail bed, it is pink, no cyanosis, capillary refill is less than 3 seconds. Texture is good. We're going to look, we're going to feel his posterior tibial pulse, 2+, the dorsal pedis, 2+. All right, I'm going to have you press against my hands here. Now I want you to point your toes towards your body. Now away from your body, I want you to point it inwards and outwards. All right, very good. Now we're going to take a look at his hip and knee joints. We're going to start with the hip. We're going to flex your leg up here, and we're going to do an external rotation, internal rotation. We're going to straighten it out. We're going to do an abduction and adduction. We'll do it on both sides so I can show you. So we're going to do flex, we're going to do external rotation, internal rotation, lay it flat. We're going to do abduction, internal rotation. All right, so I'm going to just check your muscle strength here. So I'm going to flex, and then you try to push up, and then push down with your calf. Very good. Do the same thing on this leg. Okay, and then down. All right, very good. Now I want you to take the heel of this foot, put it on the heel of your left, and run it down and up. All right, I want you to do the same on either side. All right, very good. Now, what I want you to do is sit up for me, please. I'm going to check your reflexes real quick. So, I'm going to put my arm underneath here. I'm going to have you just rest your leg on here, and I'm going to check the patellar reflex. Okay, that's about a 2. While I'm here, I'm going to check the Achilles reflex. Okay, it's about a 2. And then the Babinski, sorry. I'm going to just run this along your foot. Okay. I'm going to do the same thing on this leg. Patellar reflex. Okay, very good. 2. I'm gonna have you kind of rest right there. Okay. Okay. 2, and then the Babinski reflex. All right, very good. So now I'm gonna have you stand up. I'm gonna have you flex forward, then backward. I'm checking your range of motion. Left, right. All right, now I'm gonna have you just stand straight up. I'm gonna stand by you in case you're deviating to one side, leaning forward or backward. All right, very good. Now I want you to walk to your right side. I'm looking at his gait. He has an even gait, steady gait, and I want you to do heel toe towards me. Okay, very good. And I want you to walk away from me on your heels. Very good. And then I want you to walk towards me on your toes. Very good. Now I'm going to have you face this way. And I'm just going to look at the symmetry of his spine and his scapular region. So I'm going to have you bend forward. And it's symmetrical. His spine is midline, iliac crest is even, gluteal folds are even. Okay, go ahead and stand up. All right, and also you'll note that the curvature of the spine, you want a good curvature of the cervical, thoracic, and lumbar spine. All right, so that concludes our physical assessment. I want to thank you for tuning in.